Do you take good care of your eyes? With virtually no symptoms, glaucoma, the silent thief of sight, can quietly cause harm.
It is the leading cause of vision loss and blindness in the United States, and here to talk about the importance of yearly dilated eye exams, we have optometrist Dr. Samantha Kelly-Seltzer with MyEyeDr in Savannah. Welcome.
Good morning.
Thank you.
You call it the silent thief of sight. What is maybe the biggest misconception people have about glaucoma? Is it age?
Well, the older that you get, the more after the age of 60, your risk for glaucoma increases, and after that as well.
But it can happen. I mean, it can happen in younger people as well.
It does, but it's more common in people in middle age to the elderly.
Okay.
And also African Americans are more at risk for glaucoma.
Yeah, we were sitting here before saying, you know, can't remember the last time you had your eye. It's actually something you're supposed to do every year. I didn't know that.
Yes, it is. And the scary thing about glaucoma is you have no symptoms. So the only way to be diagnosed with glaucoma is with a comprehensive eye exam by your eye doctor.
And what exactly is glaucoma?
Glaucoma is a disease that affects the optic nerve in the back of your eye. And what it does is it slowly deteriorates, and once that vision is gone, you can't replace it.
So it can be diagnosed early? Or earlier?
Yes.
Okay. Only through the
comprehensive eye exam.
The dilated eye exam. A lot of people have insurance, not necessarily vision insurance, so it's one thing that they put off.
Yes, that is true, but a regular exam can sometimes be under your medical insurance as well. Especially if you have the risk factors for glaucoma, like systemic diseases like your high blood pressure, diabetes. That is also a risk factor for glaucoma.
Is there a hereditary factor?
Yes, it is. So it's really important to talk to your family to see if they also have glaucoma, because it's a 20% increase in chances of that you will also get glaucoma.
Wow. And if you're diabetic, or what was the other thing?
High blood pressure and heart disease.
And heart disease.
How is a dilated eye exam different than the old, cover one eye, read the chart test that we used to take?
Well, the covering up the eye shows the visual acuity, but it doesn't really give a good estimate of the health of your eye. You could be 20/20 and slowly, progressively losing vision. That's the scary thing about glaucoma. It's estimated that 3 million Americans suffer from glaucoma, and unfortunately by the year 2030, there will be 4.2 million Americans with glaucoma.
What about treatments?
There is no cure for glaucoma, but there are treatments that are available. There's eye drops that will lower the pressure in your eye, which will slow down the progression or sometimes stop the pressure or the progression of your glaucoma. There's also laser surgery that can also decrease the pressure of your eye. And there's also conventional surgery that will change the anatomy of your eye to lower the pressure in your eye.
Is this something that you can drive after immediately, or do you need somebody to get you to and from an appointment?
The dilated eye exam? Some people are more prone to have blurry distance vision after a dilated eye exam, but the big thing with the dilation is that it makes you more sensitive to the sunlight and decreases your ability to focus up close. So it's really difficult to go back to work after getting a dilated eye exam.
Oh,
especially
good.
If you're in front of the computer.
You can have it tomorrow, aren't you?
You have that excuse with you when you get to MyEyeDr. Are there 2 locations? There's Savannah.
Well, actually, MyEyeDr has many locations all over southeast of the United States.
Yeah, right.
But here locally, we have an office in Savannah where I work. We also have an office in Pooler, Rincon, Brunswick, Statesboro, and Kingsland.
Okay, so a lot of them. And is it a full service eye care?
Yes.
From children through adults?
Yes.
Okay.
Yes.
How young should children be when they get their eyes checked?
Well, it is recommended that before they enter school, they have a comprehensive eye exam at the age of 5.
Okay.
But it's also a good idea if you see your infant having some issues, missing milestones, to go ahead and get their eyes checked as well.
Right. Dr. Samantha Kelly-Seltzer, thank you so much. MyEyeDr, we appreciate it.